Hello friends, this is Dr. Nikita here, your educator, mentor and friend. And today in this video, I'm going to talk about 5 very commonly done mistakes that can cost you big time for your upcoming NEET PG or FMGE exam. Number 1, it is just doing the notes or the theory and not practicing the MCQs. I have seen so many students, even in the second and third attempt, they keep doing the same thing that they have done in the first attempt. Remember, if you keep doing the same things, you are going to get the same results. So you definitely need to focus on the MCQ practice and developing your MCQ solving skills, because all these exams are based on MCQ. And there will be quite a few questions in the exam that you can solve even if you don't know the answer, if you learn the MCQ skills that we discuss in our live classes on the Medsynapse app, which is like finding the odd man out, ruling out the options, all those tricks that you need to learn. Definitely they help you boosting your score. So do a lot of MCQ practice, don't just do the notes. Second, not doing adequate revisions and just running behind, completing your daily targets and reading new every single day. It is very, very important that every single day you have some time which is spared and essential time for revision. Because without retaining what you are studying, nothing is going to make sense. Like I always say, do not read or do not study anything that you are not going to revise. If you spend your time in something like that, that means that time is wasted. So reading something that you are not revising, giving a GT that you are not reviewing, it's an absolute time waste. Daily revision and spaced repetition is a must. For spaced repetition, whatever you do today, try to revise it tomorrow itself, then at the end of the week, and then at the end of the month. So that is how you should keep doing spaced repetition. It is no rocket science on how do toppers remember the stuff. It's all about regular spaced repetition and revision. That is very, very, very important. So whether or not you are able to complete your daily target, but revision has to be must. Third common mistake, giving the GTs and not reviewing it properly, not analyzing them properly and not learning from them. Do not have the fear of, if I give a grand test, a mock test, and if I score low, it is going to affect my confidence. No. Use these mock tests and grand tests as a learning tool. Retrospectively learn from them. It's always better to make mistakes here when you are on the practice ground rather than making a mistake in the final exam. So every mistake you make in the grand test is actually preventing you from making that mistake in the final exam. So when you are reviewing the grand test, what I would suggest is do it subject wise. First do the incorrect ones review, and even in that first review the all incorrects in anatomy, then all incorrects in physiology, and make notes as well, because it's very difficult to go back to the apps even if you bookmark the questions and revise those questions. Every question, every mistake that you make should go as just one-liner, two-liner in your notes, and all your anatomy points at one place, physiology at one place, so that you can review it at the last minute. Coming to the fourth point, not consolidating the material. Now, if you don't consolidate your material, this is what leads to panic in the last 1 week or the last 10 days before the exam, where you'll be like, now, how do I finish medicine in half a day or one a day? How do I do 2 subjects in a day? If you have your notes concised, consolidated, it's going to help you big time for that last 7 days or 10 days revision. And whatever you revise in that last 7 to 10 days, it definitely gives you a good memory and you are able to spill out that well in the exam. So if you have not done yet, you still have 1 month for your exam. So make sure you are starting to make notes, at least, the PYQs you are putting at one place, or maybe your volatile points you are putting at one place. It's very, very important to make notes for the last 7 to 10 days. Next common mistake, letting that doubt creep in. Especially as the exam approaches, that anxiety, that doubts creeps in, and it keeps growing with every single day as the exam approaches. Please remember that even if someone who's about to get rank 1 in the upcoming exam, that person also goes through the same feeling. No matter how much time you get, even if I give you 10 years, you are never going to be exam ready. The time is never going to be sufficient and you will never get that feeling that I am ready. This time that you have, it is a very good time and the most productive time that can actually be, and the most efficient and effective time if you use it properly. So prioritize what you have to study in a day. Fix it the night before, that this is what I'll be doing tomorrow. Your time blocks should be fixed, that in the morning 2 hours, this is the syllabus I want to complete. Then I have to solve so many MCQs. Then I have to revise. So time blocks, practicing that is very, very important. And remember that everything seems difficult till it is done. Right? Even when I was giving my exam, I had the same feeling, but I never knew that I will get that rank 10 in the PG entrance exam. So everybody has that same feeling, right? It's just that do not let it overpower you and do not let it drain your energy and drain your time. Coming to the next one, doing only NEET PG PYQs if you're appearing for NEET PG, doing only FMG PYQs if you're appearing for FMG. That is another common mistake. In the recent years, we are seeing a lot of overlap in the topics and the questions that are being asked, especially the NEET PG FMG. So if you are giving NEET PG, remember you have to do all the NEET PG PYQs and all the FMG PYQs, plus at least 2 to 3 years of INICET PYQs. That's very, very important. If you have not done it yet, please start doing it, because even the recent FMG papers, if you see, the questions are really good and you would definitely see those appearing in your exam as well. Like in the last INICET exam, we did see questions coming from FMG. In FMG exam, we did see questions coming from INICET. So definitely that overlap is there. So rather than solving random questions, what I would suggest is prioritize first finishing of the PYQs of NEET PG, FMG, and at least 2 to 3 years of INICET. You should get 100% accuracy in these questions. It's not just the PYQs, it is the related topics that you have to master, because questions will not be repeated as it is, but the topics are definitely going to be repeated. And making a mistake in a topic that has been asked previously, it's like a blunder. It affects your rank significantly, and you know, in exam like NEET PG, even 1 mark here and there, especially in the mid-range, affects your rank significantly. Even in FMG exam, the importance of 1 mark, you can ask somebody who's got a score of 149. Right? So it's very, very important that you master these PYQs and the related topics first if you have not done that yet. And you will get a free PDF of all the PYTs of NEET PG and INICET on my app, the Medsynapse app by Dr. Nikita. You go to the short course, and in that content, you would see the Magic Book PYT PDF folder, which is there. You would get all the previous year topics categorized topic wise for all the subjects. So make the best use of that. If you want a handy list of this is what are the topics to be covered first, mastered first in a particular subject, right? And also, let me also tell you about all the tricks, the mnemonics, the mnemonics that help you in saving your time in the real exam. You would only understand the importance of it when you learn them, and in the real exam, they help you answer those questions fast, very reflexly, and it helps you save time for the other questions that are a bit difficult. So if you have not done yet, please watch all the short videos in the Medsynapse app by Dr. Nikita. It is around 80 hours of content, and it will definitely give you 100 to 120 questions in your exam. That's a minimum that I'm talking about. Plus, we have a lot of MCQ and test discussion videos in the app where I solve the questions with you and I tell you that how do you approach a question, how do you read a lengthy question fast, how do you rule out the options, how do you logically guess the answer. There are so many videos in the app that are going to help you build those MCQ solving skills. So please make the best use of that. And with that, all the very best for your exam. If you have any queries, if you have any difficulties in your preparation, please to let us know in the comments. I shall be more than happy to help you. Keep studying, keep revising, keep Medsynapsing, and keep winning. Thank you.